sir. My name is Carly. I'm a nurse practitioner student from Oakville University, and today I'm here to do a complete health history and a head-to-toe physical exam on you. Is that okay?
Yes.
Okay, I'm going to start off by asking you some questions.
Okay.
What brings you in today?
Just my yearly checkup.
Okay. Have there been any changes in your health over the past year?
No.
Okay. Have you been sick at all lately?
No.
Nothing?
No.
Okay. Have you had any increase in fatigue, any fevers or chills?
No, not that I can recall.
Okay. How about any loss of appetite?
No.
Unintentional weight loss?
Nope. I
Okay.
wish.
How about any allergies to medications?
Nope.
Okay. Or any food allergies?
Nope.
Okay. Are your immunizations up to date that you know?
Yeah,
Okay. Have you had the flu shot yet this year?
I have.
Okay, very good. Are there any medications that you take on a daily basis?
No.
Okay. How about anything over the counter?
Sometimes I'll take like a Tylenol if I have a headache or something, but usually doesn't really happen, so
Okay.
just in case.
How about any supplements, vitamins?
Yeah, take vitamins, like vitamin D.
Okay.
Pretty much it though. Multivitamin.
Okay. And how about your past medical history? Have you ever been diagnosed with anything?
I have not.
Nothing. Okay. And how about your family? How's the health of your parents?
My father has, I believe, heart disease. My younger brother, Timothy, has type 2 diabetes.
Okay. How about your mother?
She has nothing.
She's alive.
She's alive, yep.
Okay. Do you have any other siblings?
I have an older brother, Toby. He has nothing.
Okay. And how about any children?
Do I have children?
Mhm.
Yes.
And are they healthy?
Yes.
Okay. Any family history of cancer?
No.
High blood pressure?
I believe my father may have high blood pressure, but I'm not 100% sure.
Okay. How about any respiratory problems
No.
in your family? Okay. Have you ever had any surgeries?
I have.
And what was it?
It was my rotator cuff on my right shoulder.
Okay. And what year was that?
2004.
Okay. Have you ever been hospitalized?
No.
Okay. What do you do for work?
I am a team leader at Quicken Loans.
Oh, do you like it?
I love it.
It's great.
Yeah.
How many years have you worked there?
5.
All right. How about any leisure activities?
Just hanging out with my family.
Okay.
Hanging out with my daughter as much as I can.
Sounds good. Do you exercise?
Try to get in the gym as much as I can, but probably maybe once or twice a week.
Okay. Do you do like cardio? Do you
Mostly
lift weights?
cardio.
Okay.
Mm-hmm.
And how's your diet? What kind of foods do you typically eat?
Just your average things, such as like pasta. Maybe I'll have a pizza here and there. Nothing too crazy. Salads, soups.
Do you eat many fruits or vegetables?
I would say I do. Maybe like not every day, but maybe 2 or 3 times a week, if that.
Okay. And do you smoke?
No,
Never smoked?
never.
Okay. Do you drink at all?
I mean, I've had drink, yeah.
Like, how often would you say you drink?
Just on occasion, maybe like once a month if I go like out with my friends or something.
Okay.
But nothing like too heavy. Not to get buzz or anything, but just to have some cocktails.
Okay.
Yeah.
And how about any recreational drugs?
No.
Okay.
Nope.
All right. I'm going to move on to the physical exam portion, okay?
Okay.
I'm just going to start with your skin. I'm going to just kind of generally look over your skin. Also look at your hair. Make sure I don't see any excessive dryness, oiliness. Looks pretty good. I'm going to look at your nails. They don't look brittle. Okay, very good. Move on to your eyes now. I'm going to just inspect your eyebrows and your area around your eyes, the orbital area. Your external eyes, your conjunctiva, look for any redness or yellowing, which I don't see. Also, I'm going to test your visual fields. So if you could follow my finger, just with your eyes. Good. Okay, good. And now I'm going to test for convergence. So I just want you to follow my finger. I'm going to come close to good. And then what I would do with my fundoscope, which I don't have today, but I would look in each eye, and I would look for your red reflex, your optic disc, and your retinal vessels. That completes the eye portion. Now I'm going to move on to your ears. For that, I would just inspect your external ear and the skin surrounding your ear. Okay, do you have any pain?
No.
Okay, same on this side, any pain there?
Nope.
Okay, and I'm just going to also inspect the canal. Alright, I don't see any exudate or any signs of trauma. And then, same thing, I don't have an otoscope today, but if I did, I would inspect your inner ear and look at your eardrum, your tympanic membrane, make sure it was a pearly white color, and look for the light reflex. Moving on to your nose, I'm going to just inspect the skin on your nose and also your ears. I'm going to palpate your sinuses. I'm just going to feel the frontal sinuses. Do you have any tenderness, pain there?
No.
And the maxillary sinuses?
Nope.
Okay. And also, again, with my otoscope, I would just look at both of the terminates inside of your nose. Okay, and then I'm going to move on to your throat and your mouth. I'm just going to inspect first your lips, and then I'm going to have you open your mouth. And I'm going to inspect the hard and the soft palate, the tongue, the buccal mucosa on both sides. If I have my pen light, I would use that. And also look at your gums as well. And one more time, I just want to look at your tonsils. Can you stick your tongue out? I would use my tongue depressor, and I would see that your tonsils are normal size, which is 2+, and they don't look swollen or red at all. Moving on to your endocrine system, I'm going to palpate your lymph nodes. First, the anterior chain. Okay, good. I don't feel anything enlarged. And posterior, everything feels good there. And then I'm going to palpate your thyroid from the back, actually. So I'm going to have you look up. Okay. And swallow. Good. Okay. I can feel the thyroid rise and fall in my fingers. Then I'm going to move on to your respiratory system. First, I'm going to inspect your thorax and just kind of watch your breathing pattern. Everything looks normal there. And then I'm going to listen to your lungs. Okay, if you could lean forward, please. Take a deep breath. Good. Okay, good. Alright, moving on to the cardiovascular system. I'm going to palpate your carotid pulse. Make sure you don't have a thrill. Okay, good. And then I'm also going to listen to the carotid pulse for a bruit. Now I'm just going to inspect your chest wall. Make sure all the muscles around your ribs look to be normal. Now I'm going to palpate all of your pulses, peripheral pulses. Okay, so your radial pulse, do it bilaterally. popliteal pulses under the knees. It could also do the femoral pulse in the groin area, and then on the top of the foot, the dorsalis pedis and the posterior tibial. Okay, everything feels normal there. And I'm going to palpate the PMI, which is at the 5th intercostal space at the mid-clavicular line. Should be. Okay, very good. Now I'm just going to listen to the different areas of your heart. The aortic area, pulmonic area, the second pulmonic, tricuspid, and the mitral area, which is also the PMI. Okay, I'm going to move on to the gastrointestinal system. So for this portion, I would normally have you lay down on the exam table, but for this purpose, I'm just going to keep you sitting up, okay?
Okay.
So first I would auscultate or listen to your abdomen in the 4 quadrants. Listen for your bowel sounds. You should hear anywhere between 5 and 30 per minute. It's normal. Alright, and then using the diaphragm, I'm going to listen for any renal buoys, renal arteries, as well as the iliac arteries. Okay, good. Everything sounds normal. Now I'm going to move on to some light palpation of the quadrants. Abdomen feels soft. Any tenderness?
Nope.
Okay, I'm just going to make this a little harder now. Feel any enlargement of any of the organs? Still no tenderness?
No.
Okay. That's very good. Now we're going to move on to the neurological system. I'm going to be testing your cranial nerves 2 through 12. So cranial nerve 2 is the optic nerve, and I would actually do the same thing that I did previously with the fundoscope, and I would observe each eye, the optic disc, the retinal vessels, and the red reflex. And then I'm going to move on to cranial nerves 3, 4, and 6. So that is fields of gaze again, so I'm going to have you follow my finger. Good. Okay, good. I don't see any signs of nystagmus, which is basically like eye twitching. Moving on, cranial nerve 3 again. Can you please raise your eyebrows? Okay, good. Looking for eyelid elevation. Cranial nerve 5, testing for sensation of the trigeminal nerve. So can you feel this?
Mm-hmm.
Can you feel this?
Yes.
And can you feel this?
Yep.
Okay, very good. Cranial nerve 7, I'm going to have you raise your eyebrows again and smile with your teeth and puff out your cheeks. Very good. Cranial nerve 8. If you can occlude one side of your ear, or one ear, and tell me if you can hear this.
Yep.
And tell me when you can't hear it anymore.
Can't hear it.
Okay, good. And now the same thing, but on the other side. Can you hear this?
Mm-hmm.
Tell me when.
Can't hear it.
Okay, very good. 9 and 10. I would like you to open your mouth and say ah. Sleep your tongue out.
Ah.
Good. I'm looking for the rise and fall of your uvula midline, which it is, and also could you just swallow for me? Good. Number 11, this is push against my hand, testing the muscles in your neck, and if you can shrug your shoulders up and don't let me push down. Okay, good. Good strength there. Number 12, can you please stick out your tongue at me? And also go ahead and put your tongue back in your mouth and push your tongue against me. And on the other side. Okay, very good. Next I'm going to move on to your neurological assessment. Going to test your coordination. So I'm going to have you touch your finger to your nose and then to my finger. Good. 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 And the next one is called rapid alternating hand movements. So if you can just do this on your lap. Good. Okay, and next would be interoception. So I'm just going to be feeling on both sides of your body, different places, and let me know if you can feel equally on both sides when I'm touching you. Can you feel this? And this?
Yep.
And that?
Yep.
And the legs?
Yep.
And down here?
Yes.
Feet? Yes. Okay, good. Next I'm going to test your deep tendon reflexes. If I had my reflex hammer with me, I would test the biceps here, both sides, on both, the brachioradialis reflex, the patellar reflex, which would be right under the kneecap, with your legs dangling freely off the exam table. And also your triceps, if you can just relax your arm. And I'll test that right here behind your elbow. And the Achilles, I would have you sit on the, or stand up actually, and put your knee on the exam table. And that's how I would test your Achilles reflex. Okay, so now we're going to do some balance and cerebellar function tests. So I'm going to have you stand up for this part. Okay, so for the cerebellar function, I'm going to test pronator drift. So if you can put your arms up in front of you with your palms up and raise them up a little higher above your chest and close your eyes. Okay, good. All done. I'm just testing for any drifting there, which you don't have. And then for your balance and gait, I just want you to walk first towards me on your heels. Okay, now you can turn around and walk on your toes, tiptoes. Good. And now turn back towards me again and walk straight along this line, heel to toe. Okay, very good. And one last thing I'm going to test is your balance here. Okay, so just close your eyes, and I'm just going to lightly touch you and try and keep your balance, okay? Alright, good. And come back this way. Alright, that's it for the neurological system, and last I'm going to move on to the musculoskeletal system. So first I would just inspect the contour of all your muscles, make sure that there isn't any obvious muscle atrophy. or involuntary movements or tremors, anything like that. And then I'm going to test the strength first of your upper extremities and then your lower extremities. So if you can go like this and try and pull against me and push. Good. And I'll push out and pull in. Good. And again, lift your shoulders. Good. And now your lower extremities. Now try and push up against my hands. Good. And push your shins out, both sides. Good. And pull back. Alright, very good. So that concludes the history and the physical assessment.